Carolyn, thank you so much for stopping by Being Well today. First, tell us a little bit about your background and how you got involved in grief counseling.
Well, many years ago, I'm a clinical social worker and got my master's at the University of Chicago, University of Illinois, Chicago Circle campus many years ago. And I became interested in grief counseling after the death of my mother. My mother died, and I decided to be a hospice volunteer. And the end of that training, there was something on bereavement. And I just really got hooked into it because I wanted to be able to provide some support to people that were really suffering as I had done with my mom. And I have been conducting support groups for about 19 years now as a result of that.
Well, let's talk a little bit about that grief and mourning are not the same thing. And I think sometimes they get interchanged. Can you explain the difference between grief and mourning?
Yes, I think that people do have a little bit of difficulty with that. Grief is the internal processes that happen, the thoughts and feelings that we have as a result of a loss. And mourning is the external display. For example, in certain cultures, people wear black for a long time, or they might wear an armband. It's the external manifestation.
I'm sure as a grief counselor, you are exposed to a lot of misconceptions about grief, both from maybe the people who are going through the loss and then the outside people who, are seeing a friend or loved one go through it. Can you talk about some of those misconceptions?
Sure. I think one of the greatest misconceptions has to do with tears and crying, and some people feel that that's a sign of weakness, and that truly is not. In fact, it's very healthy to display how you feel about your loss. I think it does a couple of things. It relieves some stress, but it also provides an opportunity for someone to care for you because they see that you're in distress. The other thing is that people feel that time heals all wounds, and that is not time alone. We have to do some work around adjusting to the loss, so that's not exactly true as well. That people, another misconception is that people all grieve the same way.
Right.
And that is not true. There are a lot of parameters that goes into how one grieves, and that there's a time limit. There is no time limit on grief. When we love someone and we lose them, we feel that pain and hurt for a long time. And sometimes our friends try to help us through it by pushing us to get over it.
Right.
And that doesn't help either.
It may be a better term. It's instead of saying getting over it, it's maybe getting through it.
Getting through it. And that is an African proverb that I use a lot, is that you can't go around it, you can't go under it, you can't go over it. You have to go through the grief process. Right.
Because what happens if you don't go through it and you go around it? There's probably some things that will come up later.
Absolutely. Lots of things can happen. We can just hold that in, we become bitter. Our relationships are impacted in other ways. We can become sick. Our immune system can falter. We just aren't as effective human beings as if we can process that grief and get to a place where we can feel some healing taking place.
You talked about everyone grieves differently, and there are different factors that play into that. Can you talk about how grief affects people differently?
I think that it depends upon the relationship of the person that we've lost, whether it's a parent, a spouse, a child, a friend, and then we look at how the person might have died, the mode of death. It depends upon the availability of to view a body, because all of these things can help us to accept the loss in a way that when you don't have that opportunity, it can be difficult. Also, whether or not we are dependent, how dependent one is upon the person that has been gone, has lost.
How do you address if someone, if their loved one died in a car accident and you don't have that opportunity for closure? How do you help someone get that closure?
Well, one of the things that I try to help people with is for them to really take some time and think about what their needs are, to think about what they're feeling. And I use exercises in my group to help people to identify what they're feeling, because once we know what we feel, we can kind of face it and we can make some adjustments to it. But also to just continue that process, to not give up, because it is very difficult when you're not able to see the body. It's very difficult. So just to continue letting that person talk. I often have people use a journal to write in. I always ask them to date the journal entry so that they can come back and review that and see whether there's been some growth or whether there's been some movement in what they're feeling.
As we talked before we started taping this show, grief has a long timeline. It's not months or weeks, it's years. Can you address the first year of grief and what that is typically? Everybody grieves differently, but there are some common things that happen in that first year, and then as you move into the second year.
I think the first year, my group members tell me it's just they're confused, they can't concentrate, they're just busy doing all of the necessary things to get through the process. They have business things to take care of, Social Security, insurance, just whether they're going back to work or whether they can work, just family, just a lot of things that they're dealing with. And so they're busy, they're really busy doing a lot of things, so they don't spend a lot of time on themselves sometimes. So by the second year, a lot of the practical things are resolved. And so the second year is when the rivers open, because it's like, okay, now what do I do with my life? What do I do with myself? What do I really do? It's like they really now realize the person is not there.
Right.
Yeah.
Do you find that people have a hard time accepting that this is their new life?
Yes, I think they do, because I think that they've gone through a lot that first year. So they're thinking, also, you know, it's going to be easier. They're expecting that it's going to be easier. So it's a real shock when it's worse. And they have told me, gosh, I thought the first year was bad, but the second year was worse. So it's a surprise.
So what are some of the ways that you help people get to that acceptance stage of, you know, this is your new life, to help them to start moving forward?
Well, one sort of simple way, in one way, is that your life will never be the way it was prior to the death. Because some people think that, you know, after they come to the group and after they do some things, they'll get back to normal. Well, I help them to understand this is your new normal. And by really listening, because sometimes, you know, grief, it's just very difficult and it's very painful. And we all want to take away that pain, I think, from our loved ones. So we don't want them to feel that. But I think the biggest thing is that they have to experience the pain for healing to occur. It's sort of like if you get a scratch or you get a wound, you can't just put a Band-Aid over it before it's healed. So we have to open it up, clean it out. That's the medical model, I suppose. And then, you know, let some air into it, and then we can see the healing take place. So a lot of talking, acknowledging the feeling, supporting, listening. Again, we don't always have to talk about what's happening. We can allow the person to talk and acknowledge and validate what they're feeling. One of the things that we talk about is helping the griever to ask for help, and that's okay. And I tell people that's trying to help, don't ask the griever what you can do. If you're a good friend or if you know them, take a pot of soup over, do something, because most likely the person that's grieving is not going to ask you to do much because they think they should handle it.
Right.
So to step up, do what you can do. I do ask people to keep a journal. I really do, because I think that is very, very helpful. Be selfish. I tell the griever to be selfish.
And what do you mean by be selfish?
Think about yourself. Think about what your needs are. This might be the only time in your life that you are taking the time to be selfish. And I think that by identifying what one's needs are in this grief process, they can better help others help them, because we don't always know what the griever needs. And so if they can ask for help, be selfish, do the things that's soothing for them, because in the end, they have to live with this in a way that nobody else can.
What are some, I don't know, danger signs or warning signs that maybe a person is not, maybe they're deflecting their grief, maybe they're going down a path that is not maybe the best one, maybe it's a depression. What are some things that maybe as, you know, friends or relatives we should be looking out for that are beyond, you know, the person, you know, the normal grief? You know, maybe they're going down a depression. What are some things?
Some signs would be, for example, if the person was consistently over months bitter, very angry, feeling guilty a lot, talking about guilt, or that they might start to neglect their hygiene. They might not be as tidy as they had been. You want to make sure there is not alcohol or substance abuse misuse there. You want to be careful about if people aren't concentrating very well over a long period of time. They might even talk about suicide or talk about death a lot. They might become preoccupied. Those would be some signs that you might want to talk about some professional intervention.
Let's talk about what we can do as outsiders to help. You alluded to some things that we can do to help the person going through their grief. What are some other things that we can do as friends, as, you know, relatives, sisters, you know, to help someone get through this process?
Well, again, because people are different in how they grieve, if you know the person, I think it's important to acknowledge that there has been a loss, and really to call the person by name. That's something that people in my grief group tell me, that when people don't call your loved one by name, it's sort of like you want to skip over it. And this puts a feeling to it. This normalizes it again. So you want to do that. Again, genuinely provide help, give help if people need that. Not just to say, you know, if you need something, you know, call me, because that's not going to happen. I think I said that. Listening is very important. Listening with your heart, because we don't always have the words to be there, to allow this person to just express whatever they're feeling. If it's anger, it might be some anger. People do feel angry. They feel angry at themselves. They can feel angry at the deceased person. They might feel angry at the hospital, the doctor, whatever. Allow people to express whatever it is that they're feeling. Encourage that, actually. Provide opportunities for the person to, the griever, to just relax and be in a setting where they feel that acceptance.
I think the other thing that's important to remember too is, you know, the person who's going through the grief, it's a long process. And I think, you know, initially when someone passes away, you get a flood of support. But then all those people move on and their life moves on. And I think sometimes acknowledging that 6 months, 9 months, a year, to say something to the person, to acknowledge that I know you're still going through this is very helpful.
Sending cards is really important as well, because maybe you don't know what to say, or maybe the phone call is not the best thing maybe at that time. But sending cards, and again, knowing that it's going to be a long haul, that's another thing that I think the griever doesn't always understand, is that in the beginning there's a lot of activity. And what do I do after all of that is gone? And I think that that's when a lot of the loneliness and the sadness sets in with the person that's grieving. Just that they have to do this. They have to do it themselves, and that's really tough. And I tell my people in my group, don't be so hard on yourself. Give yourself permission to feel bad one day and okay the next day. It's okay. You give yourself permission to be you.
When do you recommend, if someone has lost a loved one, is there a recommendation as to you must join a support group and when? I mean, how do you know when you need to seek out some support?
Again, some signs would be if maybe a couple of months and the person is just seemingly depressed, seemingly more sad, doesn't seem to be getting on with their daily activities, just seemingly preoccupied. I think that a group isn't for everybody. Some people are able to manage with family, friends, volunteering, church activities, but a group can provide the kind of support that some of those other activities can't provide. And so if those things that I mentioned are happening, it would be important to at least suggest a support group.
And a lot of I'm assuming churches, area hospitals like yours offer free support groups.
Many do. There are online support groups now. I haven't checked any of them out, but there are blogs. People can go online and join a chat room where they can talk about what they're feeling. They don't have to leave home. Now, the only thing about that is, I'm old-fashioned. I'm from the old school. I like face-to-face, and I think that people need that socialization that a support group provides. Support groups, in fact, I'll tell you this real quickly, that one of the groups that I started probably 8 years ago, these ladies are still meeting once a month at a local restaurant as a result of coming together and becoming friends in the group.
Right.
So that kind of support, they meet lifelong friends in a group.
Let's address, anniversaries, holidays come up. Those can be really difficult times for the person who's lost someone. What advice can you give to help them get through those difficult
Anniversaries,
milestones?
Holidays, birthdays are all very difficult. And holidays in particular, because of the family traditions and everybody's celebrating and joyful, having parties. And if you just lost someone, you just might not feel like doing some of those things. And I think that we need to give the griever permission to not be involved in the same way that they might have been. I would tell people grieving also to really, again, assess your needs, kind of take some time out to kind of think about make some plans. For example, if you're invited out, if the griever is invited out to something, they might let the hostess know ahead of time that, I'm going to try to come, but I may not be able to stay during the whole event. And that if I leave, I'm okay. It's okay. I just can't, tolerate this right now. Another thing is that they might want to plan something different. Give yourself permission to change traditions. You might not want to go to mother-in-law's house or a daughter's house, or you may not want them coming to your house as a griever. And I think oftentimes the griever feels that they're going to hurt somebody's feelings, or this is going to be difficult. And sometimes it is because of the tradition. But that if we can, if a griever can identify what their needs are and then articulate that to the people around them, that can be helpful. The other thing is the griever might want to commemorate that death or anniversary or birthday in a way by setting a special time, maybe having people over to share in some of the good things that they remember about the person who's died. They might do some pictures, or they might do some scrapbooks, or they might decide on a special charity that the person had liked and provide money or support or volunteer or something like that.
Do you find people in your groups maybe struggle with that idea of moving forward, but then if they move forward, they feel like maybe they're forgetting about their loved one? How do you address that?
That's a big one. And because, you know, the healing that's taking place helps people to feel less stress and better. So I tell them that when they start to feel that, when they start thinking about their loved one and feel comfort, that's a sign of healing. And that they will never forget the person that they lost. It's natural to, in the beginning, think, I'm going to forget, but you never forget. And it's that constant support of acknowledgement and normalizing and helping people to know that's normal, but it doesn't really happen. And that you can go on with your life and still love the person that you lost without any disrespect or forgetting.
Well, let's, as we're wrapping up in these last few minutes, talk about moving on, because maybe widows, widowers, they may look for a new, you know, someone new in their life, and that's a big transition. What would you tell people about moving on and finding a new spouse or boyfriend, girlfriend? When is the right time for that?
That's a $1 million question, when the right time is, and obviously it's different for everybody. But one of the supportive things in my group is that I have people that's moved on and gotten in a different relationship or another relationship. And this gives strength to the people that's still mourning, that's still grieving, that there is some hope for a different life. And that because you move on by being married or in a different relationship does not diminish the love that you had for the person that you lost. And that it's okay, it's a normal progression of things to change your life, because your life has been changed and it won't be the way it was before. And it's really just a matter of continuing to repeat these things until people can internalize it in a way that fits for them. And they really do come around to that for the most part.
And how do you, you know, as a child, if you see your mom remarried, that's got to be hard. How can we as children get through that if we see our parent remarrying and, you know, well, what about dad? And
Well, the thing about children is that I think you have to be honest, you have to be truthful, because if you're not, they get confused and they begin to distrust you. And I think that you can use the words of simplicity to explain things. And just as a parent's relationship with a child continues and develops and grows, they can explain it in a way that the parent is growing and developing, and of course dad or mom or grandma will never ever be gone. I mean, they are gone physically, but their spiritual presence is always there. It's tough. In terms of talking to children about grief, would use those same words in terms of being truthful. And always let children know that they didn't cause the death. That's really important. The other thing for children would be to really allow them to express whatever they're feeling, because they grieve differently also. Sometimes they act out, they don't eat, or they may carry on as if nothing happened, but again, the internal feelings are still there. They may not express them as we do. Allow them to speak, and then help them to explore what they're feeling about whatever the situation is.
Okay. Well, we are out of time. Carolyn, I want to thank you so much for coming on the show. I know we've got lots more to talk about. We'd love to have you back again soon.
Thank you so much, Lori. It was nice to be here.
Thank you.